Hi everyone, I'm Dr. Amadi. I'm a consultant obstetrician and gynecologist. I'll be discussing myths and facts about infertility. Infertility is a common problem in the West African sub-region, and it's something that has a lot of strain and psychological trauma on families. A lot of families in Nigeria and other countries have been traumatized by the issue of infertility, especially in Africa where a lot of premium is placed on childbearing. So what is infertility? Infertility is defined as the inability of a couple to achieve conception after 1 year of regular intercourse. Most times they are not contracepting, because there are some couples that get married and it's okay, for the first 1 year we don't really want children, and they go on contraceptive pills and other forms of contraceptions. But for a couple that are non-contracepting and they are having regular intercourse and they have not been able to achieve conception after 1 year, we term those couples as infertile. There might be some slight variation to this definition, but this is the standard definition everywhere. And there are a lot of myths concerning infertility. A myth is a traditional saying or an age-long belief that is passed down from one generation to the other without any scientific evidence to buttress it. And one of such is that infertility is just a problem of women alone. That is not a verifiable evidence, because statistics have shown that in about 30% of cases, women are the cause of the infertility in a home. In another 30% of cases, is the man that is responsible. And in another 30%, it is the factor that borders on both the man and the woman together, so combined factor. And in about 10%, the cause is not known. We say it's idiopathic. The cause might actually be something that we've not been able to fathom, but at that point of basic investigation where we cannot lay hand on any cause, we say this is unexplained infertility. Okay, that's 100% contribution to infertility. So you can see that from this, it is not just a woman problem, but in Africa they place a lot of emphasis on the woman, and the woman. And usually women infertility is easier to manage than the male factor infertility. So it is not a verifiable evidence. It's not scientific to say that women are the only cause of infertility. So that's a myth. The other thing is what we call seminal fluid effluvium. A lot of women telling me that, doctor, my husband's sperm is watery because after coitus, everything just pours out like that. The question I ask them then is, if you were pregnant, will you still have this complaint? A lot of them will laugh, because I've not heard that complaint from pregnant women. It's usually among women that are trying to conceive. So that is another myth, because it's been shown from studies that even within 1 minute of intercourse, some sperm have actually gotten right into the peritoneal cavity. So that means that it is not just that the sperm is watery, but usually the semen consists of the spermatozoa, which is the main active component, and other seminal fluid from the prostate, from the Cowper's gland, just to help the sperm to swim up through the woman genital tract. And as you know, the vagina is a potential space that during arousal it balloons up, and after the act of coitus it closes up. So some of the semen will naturally flow out, but the active ones would have swum up. Again, is in the seminal fluid, some of the sperm are dead sperm. They cannot really swim. So those dead sperm will naturally find their way out. So the fact that after sex the sperm flows out does not mean that the husband's sperm is watery or is not capable of fertilizing. But that does not preclude the fact that we cannot investigate such a man. So we call that seminal fluid effluvium, and it's a common complaint among women that are trying to conceive. Then the other one is people have been told to try harder. It's not just about trying harder. When couples have been attempting to conceive for 1 year, they are not using contraception, and they've not been able to achieve pregnancy, and then somebody advised them you should try harder, it doesn't really work that way. They have to be investigated. Two of them investigated to know if there is a cause. If there's any problem, it can be sorted out. Trying harder is not the option there. When couples have tried and they are not getting pregnant, they should be properly evaluated and investigated. And thank God that there are several treatment options now, ranging from intrauterine insemination, IVF, ICSI. These are modern methods to assist women achieve their goal of becoming mothers. In fact, in this age and time, every woman has the capacity and capability to become a mother, except for those maybe whose womb have been taken in the course of removed for one problem or the other. But even for those ones, they can also go into surrogacy and other things. So every woman should have the capacity and capability to fulfill her lifelong dream as a mother. And that is very, very important. So these are some of the myths that we see in modern day time. The other thing we might need to look at here is that for women, what is the age limit for women reproductive career? Because people say that age only affects women when it comes to conception. That is not totally correct. Yes, it's been shown from evidence that between the ages of 32 to 37, about 50% of the woman's reproductive career declines. And that's why most fertility centers, when women are above 40 or even above 35, they counsel them on the use of donor eggs. But age does not only affect women, it also affects men. Because it's been shown that at the age of 40, most men will start having some form of erectile dysfunction, even premature ejaculation, and the quality of sperm also declines. At South Shore Women's and Children's Hospital, located in VI, where I work currently, we undertake proper evaluation of women for infertility, and whenever any challenge or problem is discovered, we treat them appropriately. If they require reproductive assistance like IVF and ICSI, we also have a fertility branch, the Bloom's Fertility Center, where their concern can actually be addressed. So it's a complete package for women having fertility challenges. Also, like I said, fertility is something that is paramount for every home and family. And as a gynecologist, we are determined to ensure that women get the best from available technologies in Nigeria. I'm Dr. Lucky Amadi, a consultant obstetrician and gynecologist at South Shore Women's and Children's Hospital.